your medical waste transporter provides approved containers and liners for the proper disposal and collection of regulated medical waste. They offer a variety of container sizes and service frequencies to meet local requirements. Choosing the appropriate service frequency is critical for odor and infection control, and some states have specific frequency requirements. Contact your local medical waste transporter for specific requirements for your area if needed. Regulated medical waste is defined as any item contaminated with liquid or semi-liquid blood or other potentially infectious materials that is capable of releasing this material during handling. These releases normally occur during the handling of contaminated sharps or other items that have come into direct contact with pathological and microbiological waste. Biohazardous waste can be any liquid or solid that has been contaminated where you risk infection by contact and includes human wet tissue, infectious liquids, bone, or any trash or PPEs that might be contaminated by infectious materials. Generally, there are two classifications of biohazardous waste, and they should be managed differently. One classification would be where the waste has the characteristic of being liquid or can discharge liquid if compressed at the time of transport. It can include waste that has been dried or caked, but could potentially be released to the environment during handling. It also includes any waste generated from a known infectious patient. In this case, the waste is considered regulated medical waste and must be collected in a closed container labeled biohazardous and lined with a red bag. The waste must be picked up by a licensed medical waste transporter and transported by a licensed vehicle to a permitted medical waste treatment facility for destruction. The transporter will provide tracking documents or the waste manifest to the healthcare facility, also known as the generator. These tracking documents are then retained as evidence by the generator for at least 3 years. The other classification of biohazardous waste is when the waste has been contaminated with blood or other potentially infectious materials, yet does not have the liquid characteristics described in the first case, and the amount of blood or OPIM is minimal. A contaminated Band-Aid or a cotton ball with a drop of blood on it are good examples for this type of waste. While in the facility, the employees handling this type of waste should observe universal precautions and assume that the waste is biohazardous. However, they can discard this waste into a closed, labeled container that is lined with a non-red bag. Once full, this type of waste can be disposed of as regular, non-regulated solid waste and does not require tracking documents or further management by the generator. A sharp is any object that has rigid corners, sharp edges, or is needle-like that can poke, tear, or penetrate human skin. It might be syringes, needles, blades, sharp instruments, glass carpules used in dental offices, dental burrs, orthodontic appliances such as wires and brackets, glass vials containing biological agents, test tubes, lab slides, etc. These items should all be placed in an approved and labeled polypropylene sharps container. When the sharps container is 3/4 full or reaches the container's designated fill line, you must seal the container by attaching the lid securely to the opening and placing the container in the proper area designated by your facility to be stored safely. In most states, once a sharps container reaches the fill line, you must remove this full container from your facility within 30 days. Please refer to your local waste management regulations for maximum time limits for storing full sharps containers. Also, a simple way to remember what should go in a sharps container is that it must be sharp or made out of glass and potentially infectious. Anything without these two characteristics must not be placed in the sharps container.